Modern medicine is built on controlled trials, informed consent, and the promise that a patient may walk away. But some of history's most ambitious researchers removed every one of those protections, then used prisoners, children, soldiers, patients, and entire communities as raw material. The equipment was modern. The thinking was not. These were not isolated accidents committed by one deranged doctor in a locked basement. Governments funded them. Universities approved them. Hospitals supplied the subjects, and respected professionals recorded the results in careful columns, while the people producing those results were deceived, infected, frozen, drugged, irradiated, or simply left untreated. This is not a ranking of suffering. The records are incomplete, many victims were never named, and some totals remain disputed because the institutions responsible destroyed the evidence. What survives is enough. Each program used the language of improvement. One promised safer aircraft. Another promised protection from disease. Others claimed they could strengthen soldiers, understand the mind, or build better medicine. The stated goal changed. The human arrangement rarely did. The experiment usually began with a form. Number 10. The Monster Study, Iowa, 1939. In January 1939, graduate student Mary Tudor began a speech experiment under University of Iowa psychologist Wendell Johnson. The subjects were 22 children living at the Iowa Soldiers' Orphans Home in Davenport. 10 already stuttered. 12 did not. The children were divided into groups, but the treatment was built around a lie. Some received praise for speaking normally. Others, including fluent speakers, were told that their speech showed signs of stuttering and that they must watch every word. Tudor corrected them, interrupted them, and warned them not to speak unless they could do it properly. Several children reportedly became quieter, more self-conscious, and reluctant to talk. The study did not turn fluent children into permanent clinical stutterers, as later headlines sometimes claimed, but it did expose orphans to sustained negative labeling without meaningful consent. Johnson never published the experiment. Tudor returned to the orphanage several times and attempted to reverse the damage with praise. Her own notes showed concern about the effect of the sessions. Decades later, the study became public and surviving participants sued the state of Iowa. In 2007, 6 received a combined settlement of $925,000. The data remained quiet. Some of the children did too. Number 9. Willowbrook, New York, 1956 to 1971. Willowbrook State School housed children with intellectual disabilities in overcrowded buildings on Staten Island. Hepatitis spread so easily inside that infection was treated almost as an expected part of admission. Researchers led by Saul Krugman turned that institutional failure into an experimental opportunity. Children were deliberately exposed to material containing hepatitis virus, sometimes through food mixed with infected stool extracts. The researchers wanted to distinguish forms of hepatitis, follow the disease, and test whether injections of gamma globulin offered protection. Parents signed permission forms, but admission to Willowbrook was scarce, and participation in the hepatitis unit could provide a faster route inside. The studies contributed to scientific understanding of hepatitis. They also depended on children whose ability to refuse was effectively non-existent inside an institution their families were struggling to enter. A disease already circulating through a crowded facility became the justification for intentionally delivering it. The building created the risk. The laboratory standardized it. Number 8. Holmesburg Prison, Philadelphia, 1951 to 1974. When dermatologist Albert Kligman entered Holmesburg Prison in 1951, he later described seeing acres of skin. For more than 2 decades, incarcerated men became test surfaces for universities, pharmaceutical companies, and government agencies. Many subjects were black, and small payments made participation attractive inside a prison economy that offered few alternatives. Researchers applied cosmetics, drugs, skin irritants, radioactive isotopes, and chemicals to inmates' bodies. In one program sponsored by Dow Chemical, prisoners were exposed to dioxin, a contaminant associated with Agent Orange. Patches were taped down, skin blistered, biopsies cut samples away, while dosages and reactions moved into laboratory files. The experiments operated under legal standards far weaker than those used today. In 2021, the University of Pennsylvania acknowledged that the work denied many prisoners the autonomy, and informed consent, now considered foundational, and apologized for the pain it caused. Kligman later helped develop tretinoin, sold as Retin A, and became a celebrated figure in dermatology. That success made the prison program easier to frame as productive research rather than a system in which confinement supplied a convenient population. The prison sentence had acquired a laboratory wing. Number 7. The Plutonium Injections, United States, 1945 to 1947. The Manhattan Project had produced a new element and a new occupational hazard. Scientists needed to know how plutonium moved through the human body, so hospital patients became measuring instruments. 18 people were injected with plutonium in experiments connected to the wartime nuclear program. Most were sick and had not agreed to become nuclear research subjects. Some were described in internal accounts as unlikely to survive for 10 years, yet several lived much longer. Blood, urine, tissue, and eventually bone samples were collected to calculate how the element was absorbed and excreted. One subject, Eb Cade, was injected after a serious automobile accident. Researchers then analyzed biological samples. While his medical treatment unfolded around the experiment, the injections were hidden behind secrecy and incomplete disclosure. Decades later, federal investigators reconstructed the program from records created to protect workers building atomic weapons. The patients never entered the factories. The factories entered them. Number 6. The Guatemala Sexually Transmitted Disease Experiments, 1946 to 1948. American public health researchers arrived in Guatemala with cooperation from local officials and a plan to test methods for preventing sexually transmitted infections. The subjects included prisoners, soldiers, psychiatric patients, and sex workers. Many did not know they were part of an experiment. Researchers deliberately exposed people to syphilis, gonorrhea, or chancroid. At first, exposure sometimes occurred through infected sex workers. When transmission proved unreliable, the procedures became more direct. Bacteria were placed on abraded skin or mucous membranes. In some syphilis experiments, inoculum was injected or introduced through invasive procedures. A later presidential commission found that 1,308 people were intentionally exposed to one or more pathogens, while hundreds more were used in diagnostic studies. Treatment records were incomplete. At least 83 people involved in the broader research population died during the program, although the commission could not conclude that every death resulted from the experiments. The protocol measured prevention. Consent was not among the variables. Number 5. The Tuskegee Syphilis Study, Alabama, 1932 to 1972. The United States Public Health Service enrolled 600 black men in Macon County, Alabama. Of them, 399 had syphilis and 201 did not. The men were told they were being treated for bad blood, a local phrase covering several illnesses. They were not told the true purpose of the study, and informed consent was not obtained. Researchers wanted to observe the natural course of untreated syphilis. They performed blood tests, examinations, and painful spinal taps, sometimes presented as special treatment. Then penicillin became the accepted effective therapy in the 1940s. The study continued. Officials took steps that helped keep participants from receiving treatment elsewhere. The men returned for examinations, believing they were under medical care, while researchers documented damage that medicine could already prevent. The project ended only in 1972, after Associated Press reporter Jean Heller exposed it, and a federal panel recommended termination. By then, the observation had lasted 40 years. Participants had died, wives had contracted syphilis, and children had been born with congenital infection. In 1997, President Bill Clinton formally apologized to survivors and families at the White House. The cure existed. The experiment required its absence. Number 4. MK Ultra, the United States and Canada, 1953 to 1973. Cold War intelligence officials feared that rival governments had discovered methods of mind control. In April 1953, CIA Director Allen Dulles approved MK Ultra, a secret program examining drugs, hypnosis, sensory deprivation, interrogation, and behavioral manipulation. Research spread through universities, hospitals, prisons, and front organizations. Some participants volunteered for studies. Others had no idea. In Operation Midnight Climax, CIA operatives arranged for men to be lured into agency safe houses, dosed with LSD, and watched through one-way mirrors. In Montreal, Psychiatrist Donald Ewan Cameron placed patients into prolonged drug-induced sleep, administered powerful electroshock, and repeated recorded messages in attempts to erase and rebuild patterns of behavior. Army scientist Frank Olson received LSD without advance warning at a 1953 retreat. 9 days later, he fell from a New York hotel window and died. Whether his death was suicide or involved additional circumstances remains disputed, but the secret dosing is documented. In 1973, CIA Director Richard Helms ordered many MK Ultra records destroyed. A surviving cache of financial files triggered Senate hearings in 1977. The project searched for control. It could not control its own paper trail. Number 3. Stateville Malaria Experiments, Illinois, 1944 to 1946. During the Second World War, malaria disabled Allied forces across the Pacific. At Stateville Penitentiary near Chicago, researchers deliberately infected hundreds of incarcerated men, commonly cited as 441 prisoners, so new antimalarial drugs could be tested under controlled conditions. Mosquitoes carrying malaria parasites fed on subjects. Physicians then administered experimental drug regimens and tracked fever, chills, vomiting, anemia, and relapses. Prisoners volunteered, and some received sentence reductions or other benefits, but a prison can turn an offer into pressure without issuing a direct order. The program became internationally awkward after the war. At the Nuremberg doctors' trial, defense attorneys for Nazi physicians pointed to Stateville and other American prison studies to argue that dangerous experimentation was not uniquely German. The comparison did not erase the concentration camp crimes, but it exposed the absence of a clear international standard. The research fought one war. Then it entered another trial as evidence. Number 2. Nazi concentration camp experiments, 1942 to 1945. Inside Dachau, Ravensbrück, Auschwitz, and other camps, physicians used prisoners in programs designed to serve the German military, test drugs, and advance racial ideology. Consent was irrelevant because Nazi policy had already classified the subjects as expendable. At Dachau, Sigmund Rascher supervised high-altitude experiments inside a low-pressure chamber. Air was removed to simulate climbs reaching lethal conditions. Prisoners convulsed, lost consciousness, and died while instruments recorded the collapse. Freezing experiments immersed victims in ice water or left them exposed to winter air, then tested methods of rewarming their bodies. At Ravensbrück, doctors cut into the legs of Polish prisoners, introduced bacteria, dirt, and fragments into wounds and tested sulfonamide drugs. Other victims endured bone, muscle, and nerve operations. At Auschwitz, Josef Mengele selected twins for measurements, blood draws, injections, and procedures intended to explore heredity. Many were murdered so their organs could be compared. After the war, 23 defendants faced the Nuremberg doctors' trial. 7 were executed. The judgment helped produce the Nuremberg Code, whose first principle declared voluntary consent essential. The rule arrived after the evidence. Number 1. Unit 731 occupied Manchuria, 1930s to 1945. Near Harbin, the Imperial Japanese Army operated a biological warfare complex under physician Shiro Ishii. Its official language concerned epidemic prevention and water purification. Behind the walls, prisoners were reduced to a material category. Staff called them Maruda, meaning logs. Victims, primarily Chinese civilians and prisoners, but also Russians, Koreans, and others, were infected with plague, cholera, typhoid, anthrax, and other pathogens. Doctors performed vivisections to observe disease inside living bodies without changes caused by decomposition. Frostbite teams exposed limbs to severe cold, struck frozen tissue to judge its condition, then tested methods of thawing. Other prisoners were tied at measured distances from grenades, flamethrowers, or bombs carrying infected fleas. Field attacks released biological agents beyond the facility, turning villages into uncontrolled extensions of the laboratory. Exact totals remain contested because Japanese personnel destroyed buildings and records as Soviet forces approached in August 1945. Historians commonly estimate that several thousand prisoners died inside the main complex, while biological warfare killed many more outside it. The final arrangement was political. American occupation authorities granted immunity to key participants in exchange for experimental data, keeping them away from a public war crimes trial. The information survived. Most of the people who produced it did not. These experiments were separated by flags, decades, and official explanations. Their machinery was remarkably consistent. Researchers selected people with restricted choices, renamed harm as procedure, divided responsibility across institutions, and protected the record more carefully than the subject. The response came slowly. The Nuremberg Code appeared in 1947. The World Medical Association adopted the Declaration of Helsinki in 1964. In the United States, the National Research Act of 1974 strengthened formal review of human research, and the Belmont Report of 1979 defined respect for persons, beneficence, and justice as central principles. Those rules did not emerge because science automatically corrected itself. They emerged because survivors spoke, journalists published, records escaped destruction, and the public finally learned what respectable institutions had placed behind technical language. Modern safeguards are not decorations around science. They are barriers built from specific names, damaged bodies, missing files, and experiments that someone once approved. Every consent form, independent review board, and right to withdraw exists because a laboratory can remain orderly while the system around it becomes predatory. The danger was never only the chemical, pathogen, chamber, or needle. It was the authority that decided certain people could absorb the risk for everyone else. Progress keeps its cleanest records after the damage is done.